So anyway, we did finish chapter 16, medical emergencies. So I'm going to be covering chapter 17 today, 18. Hopefully both of them. Let's see if we have time. Okay, and this is basically caring for the environmental emergencies. We went over the medical emergencies. Um, let me see if I can find it. Can't find you guys. Last Monday. So
Sir,
Monday, man.
did you record the
Yeah,
lesson from last Monday?
yeah. The only thing is that I've been at the hospital, so it wasn't allowing me to do. There's a firewall there, so I'm gonna go ahead and put this the lesson tonight through my house computer.
Okay. And the assignments, I don't think you sent the assignments
No,
from.
it wasn't letting me upload anything. So I'm gonna go ahead and put them. I think the last
Uh,
assignment was chapter 13, if I remember correctly.
yeah.
I'll
Uh,
go ahead. I'll go ahead and put them today before we leave.
okay.
Before we get out. Okay.
Okay, so thanks.
And my mouse is not working. I don't know why. I have to do this with my finger. Okay. Uh, environmental emergency. Did you get to see the chapter 16? Okay, Norma's coming in. Um, did you get to see chapter 16? I don't know if it's Alejandro or Elian that was asking me.
Oh, it was Mr. But it's because my Wi-Fi wasn't working, so I wasn't able
No,
to
no
get
problem, no
on.
problem. I mean, I did get it recorded. I just need to upload it. So I'll upload it in un ratito.
Ah, bueno.
I mean, they are saved already. There he goes. Luisa's actually coming in. Let's see. So this is chapter 17, environmental emergencies. Okay, temperatures and in the body. Temperatures and the body itself. Temperatures regulation, our process is maintained by proper body temperatures. You know, the process of maintaining proper body temperatures is done by our body through our metabolism and also by our skin. Okay, and the reason I'm mentioning skin is because, well, you know, if it gets really hot, you tend to sweat, right? The sweat is actually released by your skin. So when that happens, you cool down. And the opposite, of course, if it's too cold, you start shivering, and your musculoskeletal system starts making you stay a little bit warm. Okay. Now, there's two terms that we need to remember: hyperthermia and hypothermia. Hyperthermia basically is when the heat gain occurs faster than the body can actually release it. So if it gets really hot and your body can't release it, like have you ever, well, being in South Texas, you know what a humid day is, right? If it's too hot and your body is around the same temperature and humidity as the environment, no matter how much you sweat, you're not going to cool down. So uh, you tend to retain some of that heat. In hypothermia, like when it's very, very cold, it's when you lose that heat faster you can actually produce it. Okay. Radiation is the way have you ever sat next to somebody, all of a sudden they feel warm? Well, that's radiation. They radiate their heat. We actually lose body temperature like that. Now we have another term that we want to learn is also conduction, and the other one is convection. Conduction is when you lose body heat by touching something. Let's see if you come out of the swimming pool and you sit on a chair and you get up and you notice that the chair's kind of warm, but you're losing that heat to that chair. And I know that one of the pictures that they normally have in this what do you call it in these books is somebody sitting on a rock. You're losing that heat through conduction. Conduction is you're conducting your heat through to something else. Now convection is a little bit easier. Well, a little bit easier to learn. They have you all ever heard of a convection oven? The convection itself is you lose the body heat when air close to the skin moves away, as taking the body heat with it. So in other words, when you come out of the swimming pool and air hits you, you get cold. That's convection. A convection oven, what it does, it works in the principles of circulating that hot air and cooking meat or whatever you're gonna cook a lot faster and a lot better. So remember, radiation is when you lose it just by losing it to nothing. I mean, conduction is when you touch something and you lose heat like that, and convection is when air hits you and you lose heat through that process. Evaporation, it's a loss of body heat through evaporation of moisture in the form of sweat or skin. So just like when you come out of swimming pool and air hits you, when we get really very 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 hot, our body tends to sweat, so we can lose heat through convection. Okay. And respiration, now believe it or not, respiration, we lose the body heat by breathing faster. So people that are hyperthermic, or that have high temperatures, tend to be breathing a lot faster. And I know that in one situation, I know that there was a movie with Richard Pryor. You guys probably don't know who Richard Pryor is, but there was a movie with Richard Pryor, and they were moving from one house to the other, and he had a set of twins, and they had a dog there, and they looked at the dog, and the dog is not moving, right? So the kids go up there and let me check if he's still alive, and they get a mirror and they put it right next to his nose, and basically heat from the body when he was breathing out was coming out through there, and it steamed up the glass. Just yelled out, "Oh, he's still alive! Let's take him." Always wonder what would have happened if he hadn't steamed that mirror. They would have probably left him behind. So there you go. There's a picture that I told you about that basically kind of mixes everything up. But convection is when you lose it by air hitting you. Remember, radiation is you're losing heat. How many of you have kids? You guys can answer. How many of you guys have kids or nephews or that are small?
How small?
Well, it doesn't matter. It just as long as you were with them when they were small, when they're going through a growth spurt, they tend to increase in temperature, and you're sitting next to them, you can feel how warm they are without. Of course, you have respirations also. You lose it by breathing. Evaporations by sweating, and conduction is by touching something and losing heat like that. It just depends on what do you call it? It just depends on what do you call it? How you're gonna lose the heat itself. Okay, temperature and the body. Think about it. It is late fall. A lot of these scenarios that we give here might not deal with with us knowing the temperature, right? I mean, well, without dealing with us. Okay, but it's a fall, and you respond to a call for a teen who has actually fallen into a river after standing in the canoe in his canoe. A rescue team has then dispatched. How might he lose the heat while waiting to help the for help for waiting for help to arrive? So let's say this kid is in the canoe. He falls off. How did he lose heat? How can he lose heat? No, through the process of um through the process of this is convection, conduction, radiation, evaporation.
Convection.
I would, you would think convection because, well, he gets out of the water and he gets out, but remember he's touching the water, so he can also lose it by conduction because if the water is cold, he's losing his heat to that environment right there by touching it. If he gets out of the canoe, I mean, if he gets out of the water and gets back into the canoe, then he would lose it by air hitting him, and that would be convection. So it's a little tricky to think about it, but it's still there. So heat emergencies, our core body temperature is 98.6. Every time that you eat something and that sugar that you eat gets mixed up with what do you call it? Gets mixed up with oxygen. Every single cell in your body develops every single little machine in your cell by the mitochondria causes you to have a temperature 98.6. Heat is generated through this digestion, metabolism, and movement. Heat is lost through breathing and sweating. And then the hypothalamus in our brain has that temperature telling the body when to how to control the heat, but either by sweating or start shivering. Okay. The effects of heat loss through evaporation are greatly reduced when humidity is high. I remember I told you, I remember going to calls where we would go to where the areas where they would pick onions. I forgot. I think they called it la labor. And when we would go out there, if it was very hot, we knew people were going to be high humidity. People were going to have issues with people actually maintaining the heat because there's no way that you can actually get rid of that heat. Now, I remember also when I first started working there in Stark County, we went to a call in and what do you call it? We were actually stationed at the football game. All of a sudden, we get called. We get a call from the opposite side, the visitor side, that there is a kid that has fainted. So we drive our units around and we go to the other side, and we kind of sit down and we look for the kid, and it was one of the band members that was there, and we see one kid carrying the other kid, a guy carrying a little girl on his arms, right? And what we thought was funny was that we're looking at him, and he's crying, and he's yelling medic, 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 which is like something I had never really heard. And I told him, well, can you get closer over here? And when we saw her, she was completely drenched in sweat, but it was a very hot August night. So I told him, say, hey, do you have we started checking her, and we noticed that her temperature was very high. I mean, it was very humid, and their uniform also was, one of those that, it wasn't conductive for cooling down a person. So, the little girl overheated, but because it was very humid, she couldn't cool down. And I remember the funny thing was that, you know, one kid came over and all of a sudden we had 10 other kids coming over with the same thing because it was very humid. And I remember telling them, well, let's put him in back of the ambulance and turn on the air conditioner to cool him down. Right. And you can fan them and do whatever you want to. But I remember when we did that, well, you know, we don't have enough space in the ambulance. And I remember we had the van type of ambulance. Uh, so we sat, you know, we were sitting down and we're getting more and more and more kids. And I remember I told one of the police officers that was there, hey, bring your car over and let's sit him in back of your car. So eventually we started, you know, 2 or 3 police officers came over and they started doing that, right, to cool him down. And I turned around and I saw the coach of the football game and I told him, hey, you guys carry, what do you call it? You guys carry Gatorade. Can we have some for the kids because they're overheating? And this coach just looked at me like, who the hell are you and why are you talking to me? Type of situation, right? And I'm thinking like, hey, dude, you're not from here. You can't leave the county unless I let you leave the county. And again, the coach just gets really mad. So I had a police officer, Charlie, with me, and I told the guy, "You can arrest this guy, right, for refusing?" Yeah, of course. I mean, I was in the wrong. I couldn't arrest him, but I was just trying to scare him. And eventually, somebody brought over some Gatorade. Some of the parents. Okay. So effects of heat loss and evaporation is greatly reduced when the humidity is high, and you know those situations where humidity was very high. The very young, the very old, and those in chronic illnesses are susceptible to the effects of heat loss and cold. To the effects of heat and cold. I'm sorry. You guys, if you have a grandparent, their house is always like hot. Okay, first thing is that they start losing their sensation of temperature, so they always think it's cold. The second thing is that your body might not be producing heat, so the what do you call it, increase the temperature in the environment. So let's say their house, and it's always hot. You perform a history and physical exam. Remember the physical exams? Well, the history itself is the sample history. We also have the OPQRST, and we also include, and with that one, the AVPU. So we can make sure that these guys are actually working, their system's working, and it might not be something that they might have taken as a medication and it's screwing them up. Okay, so things to do if you suspect heat stroke. Let me see if I can get my little pen. If you have suspect heat stroke, no. If you suspect heat stroke, check to see if the skin is moist. If it is moist, check to see if the patient is responsive. In other words, call him out. Or if he's looking at you. If yes, provide fluids. Now, if they're conscious, you can provide fluids if they're awake. If they're unconscious, don't try to give them anything by mouth because they might actually aspirate into the lungs. Monitor ABCs and check for vital signs. And then eventually you reassess that depending if he's conscious or unconscious every 5 minutes or every 15 minutes. Now, if the skin is moist and it's not moist, rapidly cool the skin or protect the skin and provide oxygen. Okay. If the patient is not responsive, cool the patient, protect the airway, and provide oxygen. And eventually you go monitor the ABCs, and then you reassess. Heat cramps. Signs and symptoms: painful muscle spasms, following a strenuous activity in hot environment, usually caused by electrolyte imbalance. And the electrolytes that we have, the main ones to maintain our liquid in our system is potassium and sodium. Okay, we have other electrolytes, but those are the two main ones. Patients fully alert and sweaty with normal to warm skin temperature, but they're complaining of heat cramps. And usually what happens is we have these mechanisms in our cells called the sodium potassium pump. Okay, and I'm gonna tell you, if they get messed up, if you have too much potassium or too much sodium, then you're gonna have tetany, or basically is a cramp itself. And I'm gonna give you an example that happened to me when I was in Mexico. We had a patient I had a patient that I was seeing, and she came over and told me that she was having problems with diarrhea. So I was checking her, and I kind of, she didn't have an infection, she didn't have anything else. So I told her, something, you have an imbalance in your intestines with the sodium potassium pump. So why don't you get a couple of bananas? Okay. So lady left, came back the next day and told me that, she came over and she goes, I tried the bananas, but I still have diarrhea. Something is, well, I can give you a medication, and like Imodium to actually control your diarrhea. But let's see how that works. So now I'm sitting with her, talking to her, and she has her bananas with her. And I'm thinking, man, those are big bananas, right? She looks at me. She goes, ay, doctor, no sé cómo pensaba que me iban a caber. And I'm looking at her all dazed, as like, what the hell did she just say? And so I'm looking at her and I'm wondering, what is it that she's trying to tell me? How are they going to fit her? So when I told her to get the bananas, I'm more than sure I mentioned and eat them. She wanted to use them as plugs, so she didn't have diarrhea. Dude, I don't make this stuff up. This actually happened, and I cannot. I had to walk out of the examining room, like trying not to laugh because she wanted to use the bananas as plug. So anyway, heat cramps are usually caused by electrolyte imbalance also. So I know that when I was a kid, if we were gonna go run, I was in a tennis team, and we were gonna go run, they will give us salt pills, which is sodium pills, to help us retain the water. But that would cause us to actually have heat cramps, because now there's too much sodium instead of potassium, and you get cramps. Okay, heat cramps, emergency care, move to a cool environment and replenish the fluids. So you can actually give, it's like how they actually invented or developed Gatorade? You guys know what Gatorade is, right?
Yes.
So eventually they found out that you can lose electrolytes by sweating. So they found out what was in that sweat, and now they made it into a drink. So let me ask you a question. How do they make Gatorade? So what they do is they have a whole bunch of chunky people or fat people running on a treadmill, and they're collecting all the sweats that these guys are having, and then they put a little bit of flavor on them. It's not true, guys. But they found out what was it that you're losing in your electrolytes, and eventually they know what to replenish. Okay, heat exhaustion. Exposure to excessive heat for prolonged periods of time. Cooling mechanisms begin to fail, and the body barely is able to shed as much heat as it is actually generating. So in other words, you overtaxed your body. So now you're losing more heat than you can actually control. I'm sorry, you start you can't shed as much heat, and your body can't cool down. That's what I meant to say. Heat exhaustion, signs and symptoms: mild to moderate respirations, warm or cool skin temperature. Skin color may actually be normal to pale. And you have weakness, exhaustion, and dizziness. You have nausea and vomiting also occurring. Because once your brain starts sensing that it's lacking something, it's going to get mad at you. So it's going to cause you to have this. Signs and symptoms also: you have muscle cramps, usually in the legs, rapid weak pulse. And the reason you have a rapid weak pulse is because, well, you start losing fluids. And if you start losing fluids through sweat or whatever other way, your body tries to compensate to maintain the blood pressure. So it increases the heart rate so you can actually maintain that blood pressure. And then you also develop rapid shallow breathing. Emergency care for heat exhaustion: take appropriate BSI precautions, wear your gloves, wear your goggles, your gown and mask. Complete primary assessment, make sure that all those three are complete. Ensure breathing is adequate. Move the patient to a cool area and loosen and remove excessive clothing. Remember, you're trying to get the patient cool down through the process that we learned, and one of them would be convection. Okay, so let's say if you remove their clothes, they start cooling down because air is now hitting them. You have them back at your ambulance, and you put the air conditioner on. Emergency medical care for heat exhaustion: cool the patient by fanning. Be careful not to overcool the patient because now you have hypothermia. Place the patient in recovery position just in case they decide that they want to vomit. And remember the recovery position would either be left or right lateral recumbent. And provide oxygen for your protocol. And I would just provide oxygen to everybody until you get a pulse oximeter and find out that if they're normal or not. So heat cramps and exhaustion, you have what they're doing right here. Remember in the position, the shock position, that you can actually have somebody, you elevate their legs at the point of where their hips are at. So she put something under their legs to elevate them, because any blood that's going to the legs, well, you want it to stay in the brain and heart and lungs. And she's checking the temperature right here and probably checking to see if he's conscious or unconscious. Okay, heat stroke. Now the temperature regulating mechanism fails. You're unable to actually get rid of that excess heat, so your body stays with it and your temperature increases. Core temperature allowed to rise uncontrollably, causing the body to actually overheat. It is life-threatening. It's a life-threatening emergency. The temperature may actually increase to about 105 degrees. And working, living in an area where we live, which are very close to the border, when we have a lot of those guys from other countries coming over and trying to cross over ranches whatsoever, they keep on walking, and it might be a very hot day. They can get into a heat stroke. I know that we were giving classes to Border Patrol agents on how to treat patients that they find in the middle of nowhere with heat stroke, because they'll give them some water, but no matter how much water you give them, if they can't regulate their temperature, then they develop heat stroke. Signs and symptoms: altered mental status. In other words, they're not all there mentally. Lack of sweating. Once you stop sweating and it's very hot, you can't cool yourself. The reason you stop sweating is because you don't have any more fluids to perspire. So skin is red, hot and dry, rapid shallow breathing. You have also a rapid pulse because it's trying to compensate for blood pressure loss. Signs and symptoms of heat stroke: weakness, exhaustion, dizziness, nausea, vomiting, and convulsions eventually. Emergency medical care for the heat stroke. Now, if you know that it's because the temperature is very hot, how would you turn around and treat them? Well, first, remember, protect yourself, take appropriate precautions and appropriate standard precautions, and complete primary survey. Make sure the airway, breathing, and circulation is controlled. Ensure breathing is adequate. Provide oxygen as per your protocol that they allow you to. It's because the reason I'm telling you this is because some protocols will tell you give them oxygen if their O2 saturation is 94 and below. And some other companies will, if it's 90 and below, then you give them oxygen. Okay, move the patient to a cool area and remove excessive clothing. Now, another thing you can actually do is you can wet the skin or immerse the patient in cool water to cool them down. Do not induce shivering, because shivering produces heat, right? But you don't want to do that. Place cold packs or ice packs in the pulse points. And I'm going to tell you where the pulse points are. If you have somebody that is actually overheated, you guys carry cold packs in your ambulance. Now, it depends on where you work. You might actually carry 1, 2, maybe 4, whatever. It just depends. But you put him on the neck because you have major blood vessels going through there. So you're cooling the blood as it's passing close to that through what process? Convection or conduction? Let's see if we can think. Let's see if you guys have been paying attention. If I get a cold pack and put it on their neck, you can also put it in the underarms or between the legs where major blood vessels go through. How do you get rid of the heat? Convection, conduction, evaporation, radiation, or what? Elian, wake up. What do you think?
I'm not sure, sir.
Through conduction. Because now you have a cold pack on the skin, and that the heat that you're producing is now touching something that's cooling it down. So it's through conduction. Okay. So you basically place the ice packs under the armpits, on the groin itself, or each side of the neck. Major blood vessels go through. Emergency care for heat stroke: place patient in a recovery position and monitor vital signs. So we put him in the recovery position because we don't want him to vomit or start aspirating some of that vomit. So we put him on their side. Okay. And right here, there's a picture of how they're actually, it's not the same guy that was down a little while ago, but they put ice packs under the armpits, on the neck, and then the groin itself, because we have major blood vessels going through there. Something to think about. It's a hot summer day, and you're dispatched for a man down. You arrive to find a 36-year-old male jogger who actually is seated on the ground. His shirt and shorts are wet from perspiration. He seems confused and has just vomited. What do you suspect? What else should you? I mean, first of all, what do you suspect? He's vomiting already. He's confused.
He's probably having a heat stroke.
Yeah, or heat stroke, or maybe heat exhaustion. What do you do? Well, what else should you assess? Or remember, we have to take a history. If he's conscious, he can tell us. If he's unconscious, maybe bystanders can tell us. So you can ask him their sample history, and you can ask him for the OPQ-RST or something like that. The other thing is that there's a little test that we do, and it's a very cheap test, and it doesn't cost you anything. It's called the tent test. And basically what we do is we get the skin of the armrest here or anywhere and pinch it up. Okay, so we pinch it up and it stays formed like that, then they're dehydrated. If it goes down, then they're normally hydrated. How will you actually proceed with this patient? What do you do to this patient now? Well, you can cool them down, change the environment, and cool them down, put ice packs on him, or take him back to the ambulance, turn the air conditioner on. Sometimes I've seen some medics actually have like little bottles that sprays water with a mist and just go over the body so you can actually cool them down by convection. Cold emergencies, okay? Hypothermia is when the body loses heat faster than it can actually generate it. Young children and elderly are more susceptible. Blood is shunted from the extremities to the body's core. So what happens when it gets cold? Your fingers get cold. Even the tip of your nose gets very cold because our bodies closes off all the what do you call it, the capillaries, so there's no blood flow to the skin, because if it does, then you're going to be losing heat through that process of convection. Okay, so it kind of shuts down that's why your fingers turn blue whenever you're very cold. The body is shunted from the extremities to the body's core, and the body's core includes the heart, brain, lungs, and all these other good organs, and that which basically protects the vital organs themselves. Signs and symptoms of hypothermia: cool or cold skin temperature, shivering. Absence of shivering is a late sign. Altered mental status, abnormal pulse, and lack of coordination. Signs also you might actually have muscle rigidity, impaired judgment, and complaints of joint muscle stiffness. Now what you see there, guys, that is snow. I know we don't get to see it like every maybe 10 years, 15 years. And it never lasts long enough for us to enjoy it. So we do get we do have a decrease of mental status, amnesia, memory loss or lapse, and incoherence. In other words, you can't understand what they're saying. Mood change, impaired judgment, reduced ability to actually communicate, dizziness. You have vague, slow, slurred, or thick speech, drowsiness, progressing even to the unresponsiveness. Okay, you have decreased motor and sensory functions. You have stiffness, rigidity, lack of coordination, exhaustion, shivering first, little or no shivering at later stages, and loss of sensation. Changes also in vital signs. The breathing becomes faster. Okay, rapid at first, but it becomes shallow, and at the very end, you're not going to see or hear respirations. Pulse is rapid first, slow, and then actually barely palpable later. You might actually have an irregular or absent near the end. Okay, skin is red in early stages, changing to pale to cyanotic. Cyanotic, remember, is blue skin to gray. You have waxen or hard cold to the touch. Slow respiration, pupils, or slow responding pupils, and low to absent blood pressure. Emergency care for hypothermic patients: take appropriate BSI precautions. Wear your gloves, goggles, mask, and gowns. Complete a primary assessment. Ensure adequate breathing. Administer oxygen per local protocols. remove patients from the cold environment. And a lot of times, we ask, we'll even ask you guys to remove their clothes if they're wet, because they can actually lose that heat through conduction and convection if the air hits them. Do not allow the patient to actually walk or exert themselves in any way. Okay, protect the patient from further injury. Remove wet clothing and place blanket over the or over and under the patient. Handle patient gently. Monitor vital signs. Do not give patient anything to eat or drink, including hot coffee or tea or alcohol. Severe hyperthermia. Patient is unresponsive with skin cold to the touch. Do not assume patient is dead. Okay, and remember the patient is cold, so now we have something that is actually helping them not to decay as fast as the regular heat emergency, because it's like putting your meat, whenever you're gonna buy meat, put it in the refrigerator so you can keep cool. Assess pulse for 30 to 45 seconds. If there's no pulse, then you start begin to do CPR. Patients will not give or will not be pronounced dead until the core temperature is within normal range. So you have to work these guys because they can actually survive. I know that I remember reading once that there was a kid that went underwater in a river, a frozen river, and they brought him back about an hour later after they found him. So, okay. Localized cold injury. You have cold injury, also known as frostbite. It's freezing or near freezing of the body part. It's either hands or whatsoever. It's caused by significant exposure to cold temperatures below 0 degrees or Fahrenheit or 17 degrees Celsius. Usually occurs in the extremities like fingers and toes, ears, face, and nose. Early signs and symptoms: you have numbness and tingling of exposed area, slow or absent capillary refill, skin remains soft, and if thawed, tingling and pain actually may be present. Now it depends on your protocols if you're gonna thaw them. Okay, it's warm them up, because once you start doing that, and there's a chance that they might actually refreeze themselves, the crystals that are formed in the blood through plasma are going to be bigger crystals, and they can actually do a lot more damage than anything else. So you're going to keep them warm, they're going to stay warm. Now, what you see on this one, the first one on A, is that white, waxy looking finger. On this one, when it's already black, that's frostbite right there. All that tissue is dead tissue. A localized cold injury, late signs and symptoms: white, waxy skin, firm to frozen, feeling upon palpation when you touch it, swelling, blisters, if thawed, flushed with areas of purple and actually blanching also. So we're talking about internal bleeding right there within the fingers. Emergency care for this type of injury: take appropriate BSI precautions, complete primary assessment, ensure adequate breathing, remove the patient from the environment, and remove wet or constricting clothes on the patient. Emergency for cold injury itself, early injury: manually stabilize the extremity so it doesn't move, or the affected part. Cover the affected part. Do not rub or massage it, and do not re-expose it to the cold, because I told you can actually form bigger crystals, which are going to do more damage. Late signs: remove jewelry, from the injured part because they might actually swell up and that Julie can actually act like a tourniquet. It could cover injured parts with dry sterile dressings. Place dressings between the fingers and toes prior to covering and do not break blisters. Late injury, do not rub or massage the injured part. Do not apply heat. Do not rewarm. If legs, do not allow patient to actually walk. And then basically cold related emergency, you get to see the differences here on the way the might actually be one thumb that actually, but with time, if you actually do it, all thumbs might actually, I mean, toes, not thumbs, might actually get injured. And eventually you might actually start forming blisters or whatsoever. This is a process where you actually put that injured leg in tepid water, it's room temperature water, and keep it there. So it's gonna rewarm them slowly. But remember, if there's a danger that you might actually freeze them, then you're gonna do a lot more damage. Okay, something to think about. You respond to a water-filled quarry on a hot, sunny day where a couple have been actually in scuba diving. You find that a 47-year-old petite female in a wetsuit, she is confused and actually complaining of joint pain. Her husband reports that the water is warm at 72 degrees, and they actually had been in the water for about an hour. What do you think might have happened to them? Alejandro, what do you think happened to them? What is the normal body temperature that we have? Let's see. Normal, what's our body temperature? Normal body
98.
temperature.
98?
Like 98, sir.
98.6, right?
Yeah.
What's the temperature of the water?
40 minus 47? No? No, 72.
72.
72.
So it's a lot colder than the body is. So they went through bringing the temperature down. So they're going through a hypothermic type of situation. Bites and stings. Excuse me. Assessment of emergency care, signs and symptoms of localized reaction. Notice you might actually, when we're doing our full body assessment, we look for noticeable puncture marks on the skin also. Pain around the injury site and redness and itching at the injury site. Signs and symptoms of anaphylactic shock or reaction. Remember, allergic reaction is one thing, anaphylactic is the bad one. Okay, you have weakness, dizziness, difficulty breathing, headache, nausea, vomiting, nausea and altered mental status. So you have a bite sting right there. It could be from anything. I mean, it could be from anything from a spider to what do you call it? It doesn't look like a bee sting because usually the bees leave their little sack of poison behind. But it could also be a snake or anything like that. So we look for redness around the area. Okay, emergency medical care for localized reactions. Take appropriate BSI precautions. Perform scene size up. Complete primary assessment. Ensure adequate breathing. Administer oxygen per local protocols. And scrape away bee or wasp stingers and venom sacs, which are left by those the bees and wasps. Emergency care for localized reaction. Do not attempt to pinch or pull out the stingers. Use a plastic card or a credit card to flick it off. Do not pack over the injury itself, because when you pack it, I mean, you have to realize, let's see, when a bee stings you, eventually they're gonna die, because when it stings you, it kind of gets stuck in there, and they leave a little sac behind, which is still pumping the poison inside into your body. So if you put something on top of that, you're squeezing all the rest of the poison inside your body. So flick it off, and then put something to actually squeeze it. And I think they're showing an example right there. I'm flicking it off with that way you don't get any more poison inside the system. Okay, anaphylactic shock, it's a life-threatening emergency. You have a severe allergic reaction, and it could be from bee stings, foods, like nuts, spices, or shellfish, like shrimp, inhaled substances, dust or pollens, dust and pollens, certain chemicals, or medications. Signs and symptoms of anaphylactic shock: burning, itching, hives, and rash. Difficulty breathing, you have rapid, and you develop wheezing, and you have possible chest pain because of that lack of oxygen, because your lungs are closing up. Okay, signs and symptoms, in the pulse, it becomes rapid, then becomes weak, and then once it goes absent, you have no heartbeat. You might actually have cyanosis to the lips because of lack of oxygen, swelling to the face and tongue, restlessness, and changes in mental status. Emergency care follows some procedures as used in shock. In other words, you're going to elevate the legs because whatever blood you have, you want it to go to the core of the body where your brain, heart, and lungs are. Follow local protocols regarding epinephrine and auto-injector. And that's one of the common things that ambulances are going to carry is epinephrine, whether it's through the auto-injector or the vial, you're going to have to administer epinephrine. Always call for medical direction before assisting the patient with medications they might actually have. Now, somebody that already has allergies, they might actually carry an EpiPen with them. So, they start having signs and symptoms, they just inject themselves with that EpiPen. Snake bites. Signs and symptoms. You have noticeable bite to the skin, pain and swelling, may be slow to develop, or you develop a rapid pulse. Okay. Signs and symptoms: labored breathing, weakness, vision problems, nausea and vomiting. Emergency medical care for snake bites. Take appropriate standard precautions. In other words, protect yourself before you protect anybody else. Perform scene size up, complete primary assessment, ensure breathing is adequate, locate the fang where you have it, where they got bit. If there's 2 dots, it's a viper type of bite, and if it's like teeth, it might be a coral snake. Clean the site with soap and water, because the bite itself might not produce any venom, but we don't know where the snake has been and eating or doing whatever, right? So remove this ring, any rings, bracelets, and other constricting items from the body. So if it swells up, you don't form a tourniquet effect. Emergency care for the snake bite: keep the extremity immobilized, provide supplemental oxygen, provide care for shock, monitor vital signs, and do not apply cold packs unless directed by a physician. Okay. This is something to think about. You respond to a golf course for a 62-year-old male complaining of ankle pain. Upon arrival, you learn that the golfer tried to retrieve a ball in the woods and he felt a sudden sting. There is no obvious punctures or redness, and he is beginning to have trouble breathing. How do you proceed with assessment and care? What would you do, guys? Luisa, what would you do? Well, I will wake up first from my sleep. But remember, we have to take a history. Okay, let me see. Somebody did answer. Okay. It could be a dry bite. Yeah, you're right. It could be a dry bite. But what would we do? Okay, first of all, make sure it's safe for us to actually be around the patient. So what you do is you basically start assessing him by scene size up, and then you do a primary survey. And when you do a primary survey, you basically, you're right. You assess the area, and then basically make sure that it's not dangerous for you. The other thing you want to do is look at the site and see if, again, this one is, there's no obvious puncture or with redness. Not all bites automatically become red, or you can see the punctures. So eventually you have to suspect that they might actually be going through anaphylaxis because they're having problems breathing. So what would you do to take care of them? Well, I would treat them for shock and see if they have an auto injector that might actually, that they carry because they're allergic to something. And then give them epinephrine. Now, in some of these, some people do carry Benadryl also. And Benadryl works. You're right. We do check for medication allergies or whatsoever. No, excuse me. Jeez. Being from Stark County, guys, you should know that snakes are like all over the place. Water-related incidents. Drownings. You have respiratory impairment from submersion. So let me ask you a question. If you go underwater, how much oxygen can you get out of the water? Zero. None. So basically, if they're underwater, they're not breathing any oxygen. Our key thing is to actually make sure that they get oxygenated again. You might actually have an airway obstruction by water, foreign matter in the airway, or swollen airway. There's a couple of situations where there are wet drownings and dry drownings. And what that means is when they do the autopsy, they find out there's any water in the lungs themselves. Like in a wet drowning, you're going to find water inside the lungs. But the body has a tendency of protecting itself. And sometimes when they drown, their airway closes up, so it doesn't allow anything to go in there, so they have a dry drowning. So in drownings, you have cardiac arrest, usually related to respiratory arrest. You might actually have head and neck injuries, common, especially, I know, when I was little, there was a set of swimming pools on the Mexican side in this place called, I think it was across Roma, but not to Miguel Alemán, Los Angeles. And they used to have big swimming pools there that were owned by some friends of my parents. And we would go out there and go swimming. And there's these things that are called kiddie pools. We call them chapoteaderos when we're little, right? And everybody has one relative. And we told them, hey, can you take a dive? He said, no. So we dared him. Santa Lucia, there you go. And we dared him to jump in. And it was like all of us were there, and then there's always one. I can do it. I can do it. He jumped in head first to a kiddie pool that was only like less than a foot of water. And we heard that clunk of his head striking the cement. Of course, what do? We all panicked and ran away. So we left him there. He didn't get cut or anything, but he had a big hematoma and chipote. He looked like a unicorn. And if I ask him right now to do it again, as adults, he'll probably do it again. So there's a lot of head and neck incidents that are common that happen with diving accidents. Also. Look for fractures, soft tissue injuries, internal bleeding. Water does not have to be very cold, and the time in the time does not have to be very long for hyperthermia to actually occur. Okay, do not. Oh, sorry, didn't mean to jump.
Hey,
Do not
Mr.
go-
Robert.
Yeah.
Quick question. So when
Yeah.
internal bleeding is happening, how can we determine if that it's occurring at the time? Do they get bloated, or how can we determine that if we're the first ones on scene?
There is some bloatiness that happens, but remember, mechanism of injury. Do their injuries seem like they can actually have caused internal bleeding? Now, if there's, let's see, if there's a blood vessel that ruptured, that's a major blood vessel, then yeah, they're gonna get all bloated. But what I would do in that type of situation, look for the mechanism of injury to see if it dictates that he might have internal bleeding. The other one is vital signs. When you check your vital signs, look for the pulse, blood pressure, and respirations. When we're dealing with the pulse, their pulse will be increased in the early stages. Their pulse will also, their blood pressure will actually be maintained normal. Okay, and the respirations might actually be maintained normal. I know that I had a question when I was was sent to be an EMT, and there was a question on a football player. So this football player was rushing to do a touchdown, and they knocked him. You could hear the knock across the whole football field. And they hit him on this left upper quadrant, close to where his ribs are at. So when we're assessing him, we noticed that he had a pulse rate of 92, which is that normal in an adult? 92? What's the normal pulse rate for an adult, guys? Yeah, it's 60. It's actually 60 to 100. So 92 is within normal range. Okay, and his blood pressure was normal. But everybody got the question wrong because we were trying to figure out, well, what might be wrong with the question. And they told us, make sure you look at the mechanism of injury. So what happened with this kid, he actually got hit on the left upper quadrant and where the spleen is located at. And it ruptured the spleen. But because he didn't show any signs and symptoms, you have to assume that somebody that plays football is in shape. So normally when you're in shape, your pulses should be a lot lower. So his pulse should have been at least 60, but it was at 92. So he was already showing signs of shock, and the body tried to compensate, and his blood pressure was not dropped. But if we did a full assessment, we would notice that they had a little bit of cyanosis or purple marks on that area, and we have to suspect that he might have had that spleen fracture. Of course, this was a scenario. I never went through that in reality. So if the patient is close to the shore, do not go into the water when we're really for water related incidents. Because a drowning patient will, if you jump in to save them, they're gonna drown you. They don't care, they're dying, so they're gonna try to find a flotation device, and you're the flotation device, and they're gonna push you under. The patient is close to the shore or poolside, attempt to actually reach and pull them from the water. Use a branch, fishing pole, or stick, towel, or actually an article of clothing to try and get them closer to the shore itself, and never offer your hand because they might actually pull you under. Oh, sorry, you don't have my mouse working. Reaching the victim, secure your position so you will not be pulled into the water. Throw objects that will actually float, like I don't know, like a life jacket or something like that, and throw flotation devices attached to a line so they can grab onto that flotation device, and you can pull them over like a lifesaver. And that's the type of pictures that you get to see. Remember, never have them grab you because they might actually pull you under also. Water for patient, care for patients. Now, with no neck or spine injuries, complete the primary assessment. Do mouth-to-mask resuscitation if you can. Check for airway obstruction and provide CPR. Activate EMS system and wait for them to show up. Care for patients with no neck and injuries. If the patient is breathing, perform patient assessment and control bleeding. Cover the patient to conserve body heat, and remove wet clothing to minimize heat loss. Care for patients with no neck and spinal injuries. If the patient can actually be moved, take to a warm place. Do not allow patient to walk. Allow place the recovery position. That way, if they're gonna be spewing up any water or whatever, it goes to the side and not into the lungs. And gently, and handle gently at all times. Now, patients with neck injuries, they suspect that their necks got damaged. Turn the patient face up in the water, begin primary assessment, perform rescue breathing, and float patient to shore by providing a back and neck support. And usually if you get a backboard, a lot of these backboards do tend to float in water. Okay. When the patient is out of the water, attempt to resuscitation and check for and control serious bleeding that they might actually have. Now, in this type of situation, the key thing to do first is to turn them around so you don't, they're not breathing in water because water is not breathable. Okay, once you put them on the back, then you can usually actually put a backboard in the back and basically take them safely to the edge of where the land is. And once you have a backboard, you can once you have a backboard, it's a lot easier to do CPR with that backboard than if it would if you didn't have it. Submersion injuries associated with scuba diving or decompression sickness. You have nitrogen bubbles in the bloodstream. It's called the bends. Common symptoms of decompression sickness are dull, aching, pain in the joints, typically slow onset, about 1 to 48 hours might appear. You might actually have mild to moderate signs and symptoms like fatigue, pain to muscle and joints, numbness or paralysis, choking, coughing, labored breathing also. You might actually have mild to moderate signs and symptoms like chest pain, collapse and unresponsiveness, blotches in the skin, also known as mottling. And the only thing the only way I can tell you to figure out they have mottling on them, think of a giraffe. They have different shades of in their skin, right? If you see that on the patient's body, that's called mottling. May actually change in appearance also. In decompression sickness, you have severe signs and symptoms, personality changes, distorted senses, blurred vision, and chest pain. You might actually have severe signs and symptoms, numbness and tingling in arms and in the legs, weakness of one side or more limbs, frothy blood in the nose and mouth. In other words, you have foam developing with little tinges of blood, and they might actually develop convulsions also, like in seizures. Emergency care may require immediate transport to hyperbaric chamber. And the reason is that whenever you're dealing with the bends and you come up too fast from scuba diving or whatever, we have nitrogen in our bloodstream because we're breathing nitrogen, and that gets so compressed that bubbles come out and start developing little bubbles in our bloodstream. So what we want to do is we want to make sure that they go through a hyperbaric tube, so we can give them as much oxygen as we can. Provide shock treatment, provide oxygen per local protocols, and place in recovery position in slight head down position. That is what we call a recovery position and a shock position, because now, is this the shock position, I'm sorry, or is this Trendelenburg's? Anybody? Let's see if you guys been paying attention. Shock position with Trendelenburg's. It's Trendelenburg's because they're using a backboard and you're not bending at the hips. When you think about it, you respond to a city pool for a 16-year-old male drowning victim. He is unresponsive, breathing, has a pulse, and the skin is cold. What other injuries or conditions are you concerned about at this point? Well, he's a drowning victim, and he might actually be going hypothermic because his skin is cold. Okay. How would you proceed with assessment and treatment? Well, we put him in a recovery position. We give him oxygen. Let's see. Yeah, we basically treat him for shock because that's what they might actually be going through. Oh. Ice-related incidents. Let's see, there's another comment here. Oh, yeah, I noticed a misspelling. The damn autocorrect. The ice-related incidents, unless trained to work on ice, do not attempt to rescue. It's a specialized type of training that you get. Major problems You might actually have major problems reaching the victim. Never attempt to rescue by yourself. Never go into the ice that is rapid or breaking up, and throw line to victims to reach out with a stick or pole. Throw anything that will actually float so they can grab onto it. Ice rescues require special training, protective clothing, and rescue equipment. Broken legs and hypothermia are often problems, and do not attempt to actually actively rewarm a severely hypothermic patient, and activate EMS as quickly as possible. Like in this case, they're using a ladder and the guy is going through, but he's tied to the ladder, and if something happens, they tend to pull him back. And remember, people that are in icy water tend to move less because of the coldness of the environment. So something to think about. What injuries or illnesses might not show up immediately in incidents involving ice water? What injuries or illnesses? Oh, because it's so cold, you might actually not see broken bones. They might not feel it. Okay, that's one of them. There's a whole bunch of other ones. How can EMR anticipate this and provide proper care? Well, look for the mechanism of injury. Really simple. Okay, and then we're done with this chapter. Let me see if I can get the next one. Let's see if we can go over some questions here. Let me see if there's any questions at the end of this chapter. Let me see if I can get you guys back. Now, these are simple little questions. So whenever I send you guys a presentation, it will actually give you some of the questions that you might actually get on your test. So always look at the presentations that I send you. Okay, question number 1. What are the 4 ways the body loses excessive heat? Norma, name one of them. Well, how about radiation? Luisa, name another one. Remember the oven. Convection. Gus, name another one. Conduction. Remember when you touch something cold? Alejandro, name the other one. The last one.
Evaporation, sir?
Evaporation or radiation also. Or 2 last ones.
Okay.
What are the signs and symptoms of a patient experiencing heat-related emergencies? Heat-related. So they're going through a heat stroke. What are the signs and symptoms that the patient might actually show? Well, altered mental status, rapid breathing, rapid pulse, low blood pressure, or non what do you call it? Which is rapid pulse pressure and rapid blood pressure, you have a patient experiencing heat-related emergencies. What is the appropriate assessment and care? What's the first thing you want to do? And go cheap. Person's experiencing hot-related emergency or heat-related emergency. Well, you want to take them to a cool environment, cool them down. Well, guys, this is not hard. It's just, you do the opposite. You treat the symptoms that are showing up. What are the differences? And signs and symptoms of heat stroke versus heat exhaustion. Well, eventually, when you guys start getting into heat exhaustion, you start convulsing and going unconscious, as opposed to anything else. What are the signs and symptoms of a cold-related emergency? When they freeze, well, they might actually get their pulse goes up, but eventually starts coming down. Now, you've seen movies where the people are freezing, they just want to take a nap. So they might actually go through a process where they might be losing temperature in this case. You have a patient experiencing cold-related emergencies. What are the appropriate assessments and care for a cold-related emergency? If you're allowed to, warm them up. And you warm them up so they can actually do not allow them to walk. And if you're gonna warm them up, make sure that they might not be able to refreeze later on. You guys can see the screen, right? Yeah, I'm sharing. Okay, what are the signs and symptoms of a bite, sting emergency? Bite or sting emergency. Well, redness to the site, puncture to the site. They might actually be going through anaphylaxis, which is a severe allergic reaction. You have a patient with a bite, sting emergency. What is the appropriate assessment care? Well, remember, you have to control the airway, bring in circulation, make sure it's safe for you to go there, and eventually do a secondary assessment to find out where the bite sting is. What are common methods for water-related rescues and their hazards? What are the common methods for water-related rescues and their hazards? Remember, never put yourself there so you can become a victim. So basically, reach out to them with something that they can actually grab onto, and you can pull them in. So you have a patient with a bite or sting emergency. Well, no, sorry, what is the common method? Oh, that's the common method. And pull them in. Okay, what are the common factors that can actually lead to a submersion injury? This is when we're talking about the bends. Well, they might actually have pain to their joints. They might actually have what do you call it? Altered mental status, confusion, and all this other good stuff. So, what are the signs and symptoms of a submersion, which we just mentioned? How will you provide appropriate care for a victim of a submersion injury? Well, you need to give them oxygen and transport them as soon as possible. There was an old protocol that we had to put him on the right side lateral recumbent, but I don't think that exists anymore. And that's because you would think that they will be forming bubbles in their blood, and those bubbles can actually block blood from going through. So we would elevate it so the bubbles wouldn't go into the heart and be pumped out throughout the body. Mouse working. Playing with mouse. Okay, let's see if we can start the next chapter. We should be chapter 18, right? Yeah. And chapter 18 is basically oh, let me see if I can actually load it up. Is basically caring for the soft tissue injuries and bleeding. Section the heart, blood vessels, and so I'm really freaked out with this one. And blood vessels. Okay, heart, blood, and blood vessels. Okay. Heart is a center of circulation system and responsible for pumping the blood around, oxygenated blood and deoxygenated blood. The function of blood to carry oxygen and carbon dioxide. Oxygen to the cells and carbon dioxide away from the cells. Carry food to tissue, nutrition also, and carry waste products from tissues to local to organs of excretion. I'm sorry. Functions of blood: carry hormones, water, and salts to keep the body's functions in balance, also known as regulation, and protect against disease-causing organisms, like in defense. And I know that I had gone over an explanation how the blood vessels are like highways. The red blood cells are your trailers and cars transporting things around the highway. And of course, we have white blood cells that help us with defense against organisms. And the white blood cells would be your DPS troopers. There would also be your, what do you call it? Your border patrol thing, police officers whatsoever. And of course, you have your platelets in your blood that would actually be fixing that. So that would be your workers on the side of the street that say slow men working type of thing. Functions of blood, again. And then we go over the heart itself. Remember that the right side of the heart, we can actually divide the heart into two sections, the right side and the left side. The right side of the heart is your low pressure system, and your left side of the heart is your high pressure system. And the reason I'm telling you is because you can divide the heart into 4 sections. Okay. Oh, it went up. I moved up. So we have the heart being divided to right and left side. And then we also have it divided and superior and inferior. So you have your atrias located on the top part of the heart. And atrias receive blood. The right side of the heart receives it from the body, upper and lower body. The left side receives it from the lungs. Then you have your ventricles. The function of the ventricles is to push blood out. Okay? So atrias are associated with veins, and ventricles are associated with arteries, because arteries go away from the heart, and the atrias bring blood back to the heart. So if you notice on this side, notice the difference in size right there and right there. Which is bigger? The right side or left side? This being the right side. This will be in the left side.
Left.
Yeah, the left side. Because the left side is in charge of pushing blood all the way throughout your body, while the right side, it only pushes blood to the lungs themselves so they can get oxygen. So if somebody's having a heart attack, chances are they're actually having a heart attack on their left side. Excuse me. See if I can. Capillaries basically are set up to where you're going to have oxygen being delivered to the tissues and carbon dioxide being brought back to the heart so it can get oxygenated and being expelled out. Blood contains red blood cells, white blood cells, and elements involved in forming clots, which was your platelets. Okay, plasma is a watery, salty substance that carries the solid blood and elements. Blood vessels, you have arteries, carry blood away from the heart and to the tissues, organs, and systems of the body, and veins that bring it back to the heart. Capillaries. Yeah, the smallest of the blood vessels themselves is where veins actually connect to arteries, to capillaries. And a perfusion is adequate supply of well oxygenated blood to vital organs and tissues. Bleeding, okay? Body substance isolation, because blood can actually carry diseases. Okay, risk of infectious diseases should always be assessed and minimized when caring for bleeding patients. Okay, body's automatic response to bleeding is blood vessel constriction. So the blood vessels shut down so no blood can actually go through. Severity of blood loss is based on the patient's signs and symptoms and estimation of visible blood clots. You might actually be having a patient going through shock, which is defined by blood pressure and pulse rate. Pulse rate will be increased and blood pressure will be low. And you have a decreased ability to actually clot. Can also be a factor at this point. Okay. External bleeding. We have at least 3 types of bleeding. We have arterial bleeding, venous bleeding, and capillary bleeding. And arterial bleeding is where the blood is actually squirting out of your body. Venous bleeding is oozing out of your body. And capillary bleeding is like a rug burn type of thing. So arteries carry blood away from the heart and are damaged and bright red and spurting action with each beat of the heart itself. Venous bleeding, you have vessels that actually return blood to the heart that are damaged, and you have a steady flow of red blood itself. And of course, our capillary bleeding is slow oozing or bright blood from the tissues. You have minor scrapes and abrasions to the skin. You get to see this with arteries where they're actually spurting out. Venous bleeding is actually oozing out, and capillaries is like a scrape. Evaluating external bleeding, you have to determine whether it's arterial or what. With arterial bleeding and venous bleeding, you're gonna have to put pressure on it. Okay, it may take several minutes for a clot to form. Bleeding from deep veins can actually produce rapid blood loss itself. And just because you might actually form a clot, once you let go, it might actually break that clot and you still have spurting arterial bleeding. Okay. Surface bleeding from veins can actually be profuse. Blood loss is not as rapid. Capillary bleeding requires care to stop blood flow to reduce contamination. So our key thing in all 3 of them is to actually prevent any infection. We have 3 ways of controlling external bleeding. Direct pressure, which you put pressure with your gloved hand on that cut. Elevation above the heart level, so you can actually have gravity helping you out, or use of a tourniquet also. This person is applying direct pressure, and if it keeps on oozing out, do not remove the gauze. Put more gauze on top of that already soaked gauze. Okay, so you just keep on packing it until it stops bleeding. And then in this situation, we elevate what they're trying to show you is that they're elevating the cut, if you can't control it, over the heart level. And in this one, you're providing a tourniquet, which there's a whole bunch of different types of tourniquets. So it just depends on what you guys are going to end up with. But you can always make a tourniquet also. Provide them with oxygen in case they lost a lot of blood. Direct pressure, most external bleeding is controlled by direct pressure. Never remove or attempt to replace dressing applied directly to the wound itself. It may actually interrupt blood formation and restart the bleeding itself. Direct pressure, you have a bandage that should never be removed once it's in place. So never remove a bandage to see if it's still bleeding, because the clot might actually have formed there. And when you remove the gauze, you might actually have bleeding occurring. Okay. If you use your gloved hand or dressing to apply direct pressure, you can apply pressure bandage once bleeding is controlled. And the pressure bandage is usually a bandage itself that has little strings around it, so you can actually make a tie on it, in case you haven't seen one. The most common ones are 5x9s that go in the abdomen. So at this point, they're elevating putting direct pressure and elevating it above the heart level. Okay. And then packing it with gauze. Elevation may actually be used in combination with direct pressure when dealing with bleeding from the arm or the leg. Effects of gravity help reduce the pressure at wound and slow bleeding. Do not elevate fractures to extremities, because fractures, if you start moving a fracture, a broken bone, you might actually cause more damage to the tissue. Tourniquet is a device used to actually cut off the blood supply as the point of application. So in other words, it'll stop the blood flow from going past that point. Used only when other methods of controlling are life-threatening. Bleeding and direct pressure and elevations have not worked or failed. There's also homeostatic dressings and agents, which basically, these are the 4x4s or gauzes that we might actually have you put on top to pack the cut, but they have chemicals in them to help with what do you call it, clotting. So it's a dressing treated with a specialized chemical that can actually, when placed on onto the wound, promote clotting itself. Agents in form of powder-like substances that can actually be poured directly into an open wound to help promote clotting. And there's different ones. I know that there's in the military they use those packing medical packing peanuts. When somebody's bleeding internally, what they do is they inject those packing peanuts, and once they hit moisture, they expand, causing pressure on that injury. Splinting. Splinting can also help in clotting. Application and splint can actually help control bleeding from direct pressure. You have a combining use of air splints and elevation that works well on long bleeding wounds. Consult local protocols and medical control before actually splinting to see if you'll be allowed to do it. Now, a dressing is a material preferably sterile, because when you get a cut, you lose that barrier where infection can actually go in. And what we do is we get a dressing to put on top, preferably that is sterile. That way you can actually prevent any infection from occurring. A bandage holds that dressing in place. Bulky dressings, you have multi-trauma, you have a thick dressing, often large enough to actually allow for complete covering of large wounds. You have an occlusive dressing. Now, the occlusive dressing is something that a lot of people, for whatever reason, don't recognize. But an occlusive dressing, all it is a dressing itself, a 4x4 or 5x5, depending on the size, that is covered with plastic, okay, and petroleum jelly to prevent any air or blood from escaping. So you have an occlusive dressing that can actually be put on top of gunshot wounds to the lungs, because, well, they prevent any air from going in, but they'll allow air to escape through there to reinflate the lungs themselves. Sterile gauzes, an occlusive dressing, sterile gauzes saturated with petroleum jelly, and it creates an airtight seal. And they have plastic to them, so don't forget that one. Improvised dressing, you can actually use clean handkerchiefs, towels, sheets, and or a piece of clothing. Will not be sterile, but can actually help provide proper emergency care for the patient. Okay. The bandages, we do have roller gauze. We also use cravats, and a cravat is a triangular bandage, and they resemble. Do you guys know what a bandana is? What motorcyclists wear on their head, a triangular.
Yes.
Yeah. Well, that basically they look like that, and you can do a lot of things with those bandanas or cravats. I'm sorry. You can use the handkerchiefs, strips of cloth, and material that will actually not cut into the patient's skin. Avoid the use of elastic bandages, like excuse me. These bandages are elastic bandages, and use adherent, form-fitting roller bandage that makes the bandaging easier for the patient. Do not bandage too tightly, because then you're doing a tourniquet. Do not bandage too loosely, because then you're not putting pressure on it. Do not leave loose ends, and do not cover fingers and toes, because if you want to do a capillary refill, then you can find out if you didn't cut the circulation. And the reason we're telling you is that it's kind of, well, what is right, is what's the difference between putting it too tight or too loose? If you put it too tight and you control the bleeding, the next thing you're going to have to do is check to see if their pulses after that section exist. So you can actually do a capillary refill, and the capillary refill is by pressing down on a fingernail or a part of the skin, causing blanching, and then releasing it, and within 2 seconds it should go back to pink. Nobody ever asked that question for whatever reason, but I always wonder, well, how would you know? Well, that's how you know. Make sure that you don't constrict blood flow away from that. I mean, you slow it down, but you don't constrict it. Dressing and bandages, wrap bandage around the limb, starting at the far end first. So you always, whenever you're gonna do let's see, I have a cut right here. You always gonna do from far away and roll it up to close to where the body is at. And we'll show you when we do the skills. Check distal circulation, sensation, and motor function before and after bandaging. Always, anytime that you're going to splint something, or you put a bandage, always check for PMS, pulse, motor, and sensation. Okay, remember, you start distally and you come proximal, from far away to close away to the body. This is basically a covering of a veneer. It might be a cut to the ear or the head itself. Looks like a helmet, right? This will be to the elbow, to the knee. And remember, you always start from the distal portion to the proximal. This is for the forearm itself. No blood in any of these, which is magical. To the ankle. The ankle is like kind of special because you need to make sure that it anchors, and I'll show you how to anchor it correctly when we're dealing with bandaging and splinting. This would be to the hand. And notice in the ankle itself, look at the fingers. The toes, they're exposed. And then this one with the hand, the fingers are exposed, so you can check for capillary refill. Internal bleeding ranges from minor bruise to major life-threatening problems. Can actually bring about shock, heart and lung failure, and actually eventual death. Causes by wounds deep enough to actually serve as major blood vessels, severe for major blood vessels and other vessels within the organ itself. It can actually have blunt trauma, where basically it didn't cut the skin, but you have bruising underneath. It caused by an impact, large object on a surface, and it's non-penetrating trauma, which it didn't cut the skin. Penetrating trauma does cut the skin. It's caused by objects that actually punctures the skin, and pay special attention to bruises on neck, chest, and abdomen. Signs of shock with internal bleeding. You have decreasing level of responsiveness, restlessness, and combativeness, or you might actually have that feeling of impending doom, shaking and trembling, shallow and rapid breathing, rapid and weak pulse, pale, cool, moist skin, and dilated enlarged pupils may actually be may respond or may actually be sluggish. Multi-system trauma. Okay, have trauma to the body that affects multiple organ systems. Evaluate mechanism of injury to see how they got hurt. Assume that the patient has suffered all the possible injuries that you can think of and start treating for them. If anything, just treat for shock. Elevate their legs, give them oxygen, and keep them warm. Okay, so let me see how, can't realize the soft tissue injury. Let me see how long this one is. We'll just go ahead and stop here, guys, because your next test is after this chapter. So let me see if I can post up your assignments and also the videos for this. I don't know what time it is actually, to tell you the truth. I don't have a clock with me. But we should be getting close to the 8 something time. So what we'll do is we'll stop right here, continue on Friday, and on Monday, if it's okay with you guys, have the test, or we can actually have it for Wednesday. Let's take a vote. How many want it on Monday?
¿Qué cosa, sir?
The exam, second exam, Monday or Wednesday?
Monday, no?
Well, it's up to you guys. I mean, I might want to give you a little bit more time to study. So you want it on Monday or do you want it on Wednesday? You can just
Wednesday
make a
next week.
difference.
Yeah,
Huh?
but next week is Wednesday. I'm for Wednesday.
Okay, well,
Wednesday, sir.
¿Quién más? Alejandro, what do you think?
I think Wednesday, sir. To
Okay,
study.
oh, sorry, that was you. Elian? Cuando usted quiera, sir. I think Elian went to the restroom. Norma, when do you think? Gus. Okay, well, the Wednesday's happening.
Wednesday.
Okay, we'll have it on Wednesday. We'll have a couple of more chapters. I'll see if I can get some review questions, and we'll review. Oh, somebody disappeared.
Sir,
Mándeme. Hello?
Elian dice que el Wednesday, pero no le jala el mic.
Oh, okay, no problem. That's fine. I kind of figured. So Wednesday. So, somebody's actually.
Yes, Wednesday.
Oh, Gus wants it on Monday. Then he said Wednesday. So I would imagine you want Wednesday.
Pero
Alright.
cambió de opinión y lo dijo que Wednesday.
Okay, yeah, no. Está bueno. Then, pues, I'll see you on Friday. We'll finish this chapter. And on Monday, we'll review for the test also. And we'll cover a couple of more chapters. All right?
Yes, sir.
Yes,
Oh,
sir.
you guys have a good weekend. I mean, well, a good couple of days, not weekend. ¿no?
Como que weekend of the Friday, venimos.
Pues yo sé, pero pues ya ando dormido yo.
Oh,
Sir,
Aquí estoy. I'm still here.
tomorrow le puedo dejar el otro payment, le puedo dejar mañana en la casa
Yeah,
de
you
mis
can
parents.
drop it out there with my parents or what do you call it? In the office. I might not be there because I have a doctor's appointment just to check me out. And then from there, we'll go ahead and continue that.
Okay, sir. Tomorrow.
Ahí está. Okay. Está bueno. And anybody else has a
Thank you,
chance,
sir.
just drop it off there at the office. Okay, well then I'll go ahead and see you on Friday, guys. And we'll finish this chapter up.